Across the country, we are hearing reports of clusters of cases associated with daycare centers and youth sports. Hospitals are seeing more and more younger adults, those in their 30s and 40s, admitted with severe disease. Data suggests this is all happening as we are seeing increasing prevalence of SARS-CoV-2 variants, with 52 jurisdictions now reporting cases of variants of concern. Based on our most recent estimates from CDC surveillance, the B.1.1.7 variant is now the most common lineage circulating in the United States. Testing remains an important strategy to rapidly identify and isolate infectious individuals, including those with variants of concern. These trends are pointing to two clear truths. One, the virus still has hold on us, infecting people and putting them in harm's way, and we need to remain vigilant. And two, we need to continue to accelerate our vaccination efforts and to take the individual responsibility to get vaccinated when we can. We have to recognize the high risk of infection in areas of high community transmission. I encourage communities to consider adjustments to meet their unique needs and circumstances. For example, in areas of substantial or high community transmission, CDC guidance specifically suggests refraining from youth sports that are not outside and cannot be conducted at least 6 feet apart. Similarly, large events should also be deferred. We have guidance on CDC's website on how to host small events safely, recognizing that our goals are to decrease transmission of COVID-19 and, importantly, to keep schools open and students engaged in in-person learning. To this end, I'm pleased to report that an important mitigation strategy, educator vaccination, was rolled out in the month of March, and it worked. As the president announced yesterday and Andy reiterated, by the end of March, 80% of all teachers, school staff, and childcare workers across this country had received at least one dose of a COVID-19 vaccine. That's nearly 8 million people, educating our children and working in our schools who have some protection against the virus.
Hi, thanks for taking my question. Actually, I have something of a follow-up on that because I also happen to be based in Michigan, where the numbers are looking really scary. I'm wondering, and this is for Dr. Walensky, I think, you mentioned in your statement that there might be time to sort of have some clearer guidance on after school activities, maybe staying out of indoor sports. I'm wondering, should states like Michigan, where the numbers are peaking, should there be stronger guidance? I mean, should we be looking at a pause, should there be pause in restaurants, indoor, should there be, or at least guidance to sort of stay out of indoor dining? Should that be coming from the state? Should the CDC, and does the CDC have any plans, or are you considering stronger guidance that, when the numbers are spiking like they are, especially with the possibility of vaccines, we're in this race and it feels like we're close, but we're falling behind. So I'm just wondering if there should be more aggressive guidance than we're seeing from either the state or federal officials.
Yeah, as I mentioned, we've been in close touch with the state. Our guidance on youth sports is actually pretty articulate with regard to having substantial or high transmission, and that these activities should be happening outdoors and more than 6 feet apart. In the context of that, testing should happen at least twice a week if these are high risk sports. So we're pretty clear on that guidance, and we've been working with the state. And I would advocate for sort of stronger mitigation strategies, as you note, to sort of decrease the community activity, ensure mask wearing, and we're working closely with the state to try and work towards that.